It's been a month since actor Chadwick Boseman passed away from colon cancer. He was just 43, which is younger than the recommended age for a colonoscopy. And tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker tells us who should be screened early for the disease.
Because of the coronavirus, many people are skipping regular screenings for diseases, and that includes colon cancer.
Instead of diagnosing it at an earlier, more treatable stage, it's diagnosed at a later stage, which is more difficult to treat.
Dr. Randy Wright is the medical director at the Robert B. Greene Endoscopy and GI Clinic within the University Health System and is an associate professor of gastroenterology with UT Health San Antonio. He says Boseman died before the general population reaches the age where they typically get screened.
For most guidelines, it's at 50 years old right now, except for African Americans.
That's because they are at a higher risk, but the reason remains unclear.
All African Americans should be screened for colon cancer at age 45.
Some of the symptoms of colon cancer include a change in bowel habits, blood in the stool, unintentional weight loss, abdominal discomfort, and a constant feeling of fatigue.
Colon cancer develops from colon polyps, and those polyps can take many years, 10 to 15 years sometimes, to go from normal to dysplastic, abnormal tissue, all the way to colon cancer.
The best way to catch it early is to get that colonoscopy.
The concern is if people avoid screenings or avoid evaluating their symptoms, they could develop a cancer or be diagnosed with a cancer at a later, less treatable stage.
Dr. Wright also says if you have a family history of the disease, you want to start getting screened at the age of 40 or at the age your family member was diagnosed, whichever comes first. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just go to wearthegown.com